Hi everyone, welcome to vn12nursing.com. These are your favorite students again, Iris and Ruth. We're gonna go over some NCLEX style questions for endocrinology med surg portion. We're gonna do a short review today, only 6 questions, focusing on endocrinology, Cushing's syndrome, and Addison's disease. Question number 1. Which of the following patients are at risk for developing Cushing's syndrome? A patient with a tumor on the pituitary gland, which is causing too much ACTH to be secreted. B, a patient taking glucocorticoids for several weeks. C, a patient with a tuberculosis infection. Or D, a patient who is post-op from adrenalectomy. I'll give you a couple seconds to think about it, but not too long. We are term 3 students, so we should know this. Answer is B, a patient taking glucocorticoids for several weeks. Remember guys, Cushing's syndrome is a patient taking too much glucocorticoid steroids for several weeks.
Okay, question number 2. Addison's disease is A, increased secretion of cortisol. B, increased secretion of aldosterone and cortisol. C, decreased secretion of cortisol. Or D, decreased secretion of aldosterone and cortisol. And I'm going to give you guys some time to think about it, not too long. You know, my partner just said that we are supposed to be on our feet. We are term 3 students. And I do want to ask you guys to excuse me. I'm sniffling a lot today. I'm kind of under the weather. So we're going to run right through this so I can get some sleep. So the answer is D, decreased secretion of aldosterone and cortisol. And remember guys, we already did A and P. So you guys already know what hormones are released where. And Addison's disease is a decreased secretion of aldosterone and cortisol because it's in the adrenal cortex. These are adrenal hyperfunctions.
That's right, girl. Even though we're sick, we're nursing students, so we are not sick. All right. Question number 3. A patient with Addison's disease is being discharged home on prednisone. Which of the following statements by the patient warrants you to re-educate the patient? A, I will notify the doctor if I become sick or experience extra stress. B, I will take this medication as needed when symptoms present. C, I will take this medication at the same time every day. Or D, my daughter has bought me a medic alert bracelet. Alright guys, the answer is B, I will take this medication as needed when symptoms present. So remember, these types of questions are meant to trick you. You're looking for the answer that is incorrect. What is the statement that is incorrect? And in this case is B, I will take this medication as needed when symptoms present. No, we don't take this as a PRN. We take this at the same time every day.
Okay, question number 4. We're almost there. A patient is admitted to ER. Ooh, I love ER. Okay, the patient is unconscious on arrival. However, the patient's family is with the patient and reports that before the patient became unconscious, she was complaining of severe pain in abdomen, legs, and back, and has been experiencing worsening confusion. In addition, they also report the patient has not been taking any medications. The patient was recently discharged from the hospital for treatment of low cortisol and aldosterone levels. On assessment, you note the patient's blood pressure is 70/45. Okay, 70/dead. What disorder is this patient most likely experiencing? The answers are A, Addisonian crisis. B, Cushing's syndrome. C, thyroid crisis. D, Hashimoto thyroiditis. And the correct answer is A. So if you guys remember, I think it was when we were doing respiratory, we were reminded that we're gonna see why we can't take off the corticosteroids abruptly, and we were being warned. We were warned again and again. And this is why, because when the body is suddenly removed from these hormones, the body's trying to make up for them. So with Cushing's syndrome, you have way too much, and with Addisonian crisis, you suddenly have a shock. So now this patient is experiencing everything. That's why her blood pressure is 70/dead.
All right, guys, question number 5. In the previous scenario, what medication do you expect the patient to be started on? A, IV Solucortef. B, PO prednisone. C, PO declomycin. or D, IV insulin? I'm not even going to give you time. You should know this already. Patient is dead, DED, dead. So nothing PO, right? Why are you going to give insulin? Patient doesn't need insulin. Patient needs the steroids. So patient's going to need IV Solucortev. A, IV Solucortev. Got it.
Okay, guys, so we're down to the last question. Yay. I wish I could tell you there's more where that came from, but there isn't. I'd be lying to you. Question number 6. A patient with Addison's disease should consume which of the following diets? A, high fat and fiber. B, low potassium and high protein. C, high protein, carbs, and adequate sodium. Or D, low carbs, high protein, and increased sodium. And the answer is C, sugar, salt, and sex. So C is high protein, carbs, and adequate sodium. Don't forget that in Addison's disease, you are insufficiently releasing the sugar, salt, and sex hormone, which is aldosterone, and the adrenal cortex is responsible for that. So in this situation, the patient is crashing low, so they're gonna need to keep their high protein because the body can't metabolize carbs or protein or sodium properly. So you want to make sure they are responsible for keeping those levels, because when they get discharged, we're not going to keep them on IV most of the time. They're going to have to be able to make adequate lifestyle changes. And yeah, so thank you guys for joining our video today. I wish we had more for you, like I said earlier, but maybe down the line we'll get some more questions going. And don't forget to like our video.